Greetings, future medics. Welcome back to the channel. In our previous video, we explained the major fractures of the radius and ulna, including Nightstick, Monteggia, Olecranon, Coles, Smiths, Bartons, and more. If you haven't seen that yet, make sure to check it out first. The link is in the description below, and also in the top right corner of your screen. Now in today's session, we're moving on to the 4 important ulnar fractures: Nightstick fracture, Monteggia fracture, Olecranon fracture, and Ulnar Styloid fracture. For each, we'll go through the definition, mechanism of injury, signs and symptoms, management, and complications. Let's get started. First up, Nightstick fracture. Definition: a nightstick fracture is an isolated fracture of the ulna shaft, usually in the middle third. Mechanism of injury: it often occurs when a person raises the forearm to protect against a direct blow, like defending against a stick, hence the name. Signs and symptoms include localized pain and tenderness over ulna. Swelling and deformity may be visible. Pain worsens on forearm rotation or wrist movement. Management: for undisplaced fracture, do conservative treatment with an above-elbow cast or functional brace. While for displaced fracture, we do open reduction and internal fixation with plates or nails. Complications include malunion or non-union, restriction of forearm rotation. Now let's move on to Monteggia fracture. Monteggia fracture. Definition: a Monteggia fracture is a fracture of the proximal third of the ulna associated with dislocation of the radial head. Mechanism of injury: commonly caused by a fall on an outstretched hand with forced pronation, or a direct blow to the forearm. Signs and symptoms: pain, swelling, and deformity around the elbow and forearm. Restricted elbow and forearm movements. Prominent radial head may be palpable. So, how do we manage it? Management depends on age. For children, closed reduction and above elbow cast. While for adults, open reduction and internal fixation of ulna, with reduction of radial head. Possible complications include chronic dislocation, often due to missed diagnosis. Limited pronation supination. Posterior interosseous nerve injury. That completes Monteggia fracture. Next, the Olecranon fracture. Definition: an Olecranon fracture is a fracture of the proximal ulna at the elbow tip, the Olecranon process. Mechanism of injury: usually caused by a fall on a flexed elbow, or a direct blow to the elbow tip. Signs and symptoms include swelling and tenderness at the posterior elbow. Inability to extend the elbow actively. A palpable gap may be felt at the Olecranon. Now, let's look at the treatment options. Treatment options depend on whether undisplaced or displaced. For undisplaced fracture, we do immobilization in a cast at 90 degrees flexion. Displaced fracture, surgical fixation is done with tension band wiring, plates, or screws. Complications that may arise include elbow stiffness, non-union, post-traumatic arthritis. Ulnar nerve injury rarely occurs. Finally, the ulnar styloid fracture. Definition: an ulnar styloid fracture is a fracture of the bony prominence at the distal ulna, near the wrist joint. Mechanism of injury: commonly associated with fall on an outstretched hand and often occurs alongside distal radius fractures, like Coles fracture. Signs and symptoms: pain and swelling on the ulnar side of the wrist. Tenderness at styloid process. Decreased grip strength. Management: for small, undisplaced fractures, treat conservatively with cast, while for large or unstable ones, surgical fixation with a wire or screw is done. Complications to watch out include instability of the distal radioulnar joint, non-union leading to chronic wrist pain, decreased wrist motion. That completes our discussion on the 4 major ulnar fractures. And these are the general complications you should always keep in mind. Chronic pain, malunion, non-union, chronic osteomyelitis, joint stiffness, post-traumatic arthritis, ulnar variance problems such as shortening and lengthening at wrist, and persistent nerve palsy. Well done if you've followed through to the end. Thank you for watching. Don't forget to like, share, and subscribe for more orthopedic surgery lessons.